All right, we are ready to rock and roll here. This is Joey Gilbert coming to you with Dr. Troy Ross. This is our COVID-19 update. We have been kind of just sitting on the sidelines. We're doing our job, we're working, but we've been, I guess I have at least been blindsided with question after question on what's really going on, and you can't seem to find the truth on the news media. So I wanted to have a Facebook Live and unpack what I consider the COVID-19 nonsense response that has happened here in this state, that's still happening, with a true professional, one of my good friends and someone I've been working with since this all happened, Dr. Troy Ross, who has obviously he's an MD, but he also has his master's in public health. And so here we are to discuss COVID-19. So Troy,
Yep.
say hi to the folks out there in Facebook land.
Hello, everyone. Glad to be here with you all.
So guys, there's a lot to unpack here. You know that I typically like to keep these things as short as possible, but there's just so much information. I want to see some of these people. I see people joining us, but let's get on board and let's sound off in the comments, please. It is important. It is as important now more than ever to be loud about this and to talk about it. We have our kids still sitting home from school. We have sports not started. We have seniors still, isolating, and we have the flu season upon us. And yet, it's almost like we're, once again being, coerced. Here we go again. Doesn't this seem like March again? Oh my God, get ready. Here it comes. The hospitals are overwhelming. No, they're not. Get ready. Here comes the big wave. We got to prepare everyone, the masks. Okay, no, here we are. We're still in masks. We've been wearing masks now for months. We've been isolating for months. What's happening? Why are we still in this situation? And Troy, can you please explain to the folks at home what's going on with the hospitals? Are the hospitals at capacity? Are we going to lose folks here in Reno, our loved ones, because there's no room in the hospital?
No, that's absolutely not the case. It's been pretty well established from the start of this that from the time in March when we had the emergency declared, that hospital admissions dropped off dramatically. And even now, after they have become a little more permissive in allowing more normal functions to occur, the hospital admissions are down to the point that many hospital systems are worried about whether they're going to be viable in the future.
So again, everyone, as I've been saying for a long time, the hospitals are experiencing the same volume of patients they experience every year at this time. The flu season, you see them coding or whatever they're saying. What is the word they say when they're getting red or they start getting capacity?
Yeah, just they have their colored codes
Color codes.
where they're at.
And it's no different than it was this time last year. It's no different as the time it was the year before. This is the flu season that's upon us. And isn't it kind of funny that if you look at the statistics, the flu has disappeared, heart disease has disappeared, stroke has disappeared, cancer has disappeared, and the only thing everyone's dying from right now is COVID-19? Is that how it's supposed to be right now?
Well, some of that just comes from the confusion of trying to very quickly gather statistics to understand the course of this new viral disease up against the background of what we typically have. So I've said right from the start of this that we're not ultimately going to understand what impact this coronavirus had on overall health for about a year. It's going to take a long time to really get some solid statistics versus this really quick grabbing of data that the public health and the medical professionals are trying to get right now. So in the end, I think that once that is all teased out, you'll see that they'll find those flu deaths, they'll find those other deaths. But right now, they're all being lumped into COVID. And that's part of how the public health establishment works. When we're trying to understand something new, we want to cast a wider net to make sure we don't miss anything. That was done early on. It hasn't been adjusted. As we're understanding more about this virus, we're still casting this very wide net to try to not miss anything. In the process, though, we're bringing things in that aren't really a part of this viral disease.
Absolutely. And one of the things I want to touch on with everyone, this is so important. And folks, come on, everyone start jumping on here, start getting in the comments, because this is important stuff. And we've been played, for too long. At the end of the day, one of the things I want to talk about that's most important, you've got our governor, and I'm sorry, everyone, but he's not the guy. He's an incompetent and absolutely inept person, politician. He's a hack. absolute political hack. I'll say it. I'm not afraid to say it. Why am I afraid to say it? Because here's all the information coming out on these false positives. Y'all can see this, right? The false positives. They're everywhere. False positives everywhere. Every article I pull is on the PCR test is unreliable. The PCR test is unreliable, and they keep talking about it over and over and over again. And I thought, I'm doing a great job explaining this to people, but I'm going to have a doctor on here this time because I'm too tired of getting told, nice medical degree, Joey, or where's your medical degree? I don't have a medical degree. I can use Google pretty well. I'm very good at DuckDuckGo. I'm a great researcher. I'm even better at, talking about stuff. So let's unpack this false positive thing. But as you can see from the Manila Times to the BBC, and why do I have to go to other countries, to Australia, to print out information about these PCR tests? Why is our news media, and the New York Times did cover it very briefly, but why isn't our news media talking about the truth of what these PCR tests really are, what they're finding, and what they mean? And Dr. Ross, could you help me with that?
I will try. To set the stage for this, PCR is not a diagnostic test. It never has been. It was never intended to be. It's a test to gather information that then you can take and move into other kinds of testings to confirm a diagnosis for whatever it is that you're looking for. There are a lot of variables with this. If you go back to the person who actually invented this test, Kary Mullis.
Yeah, and she's a Berkeley scientist.
He very clearly states emphatically that this cannot be used to diagnose disease. And so, that is the starting point. We can understand why, since there isn't any other reasonable way to try to find these cases, these diseases, that the PCR test might be used to, again, cast a really wide net, make sure you don't miss anything. But that's just a starting point. It's not a diagnosis.
And that's what it does. It does cast a really wide net. And what I'm learning, and a lot of people that have done some of this research, guys, let me just share with you. This is an article by John Rappaport, August 29th. According to the New York Times, all right, so I'm not making this up, potentially 90% of those who have tested positive for COVID-19 have such insignificant amounts of the virus present in their bodies that such individuals do not need to isolate, nor are they candidates for contact tracing. Leading public health experts are now concerned that over-testing is responsible for misdiagnosing a huge number of people with harmless amounts of virus in their system. And here's another important thing. Most of these people are not likely to be contagious, warns the Times. Yes, that's what the New York Times is confessing. Some of the nation's leading public health experts are raising a new concern in an endless debate over coronavirus testing in the United States. The standard tests are diagnosing huge numbers of people who may be carrying relatively insignificant amounts of the virus. Most of these people are not likely to be contagious. So what are we hearing there?
So that gets back to being very careful with the terms that you use. And even there, they're talking about diagnosis. And again, the PCR is not a diagnostic test. So they may be identifying people that need to then be diagnosed. But it still gets back to how you use a test. You don't use it indiscriminately. In this case, if you have somebody that you think might be ill from this disease, then that could be an appropriate test to start your whole diagnosis tree, how the algorithm that you use to get to a final diagnosis.
Absolutely.
And just to get back to the problem with the PCR test being used the way it is, there's something called the cycle threshold. How many times you replicate your sample in order to find those little tiny protein fragments. If you do it enough, you can always get a positive, which is why there are standards for how many cycles this test should run at in general. But in this case, in this emergency use authorization, all of these tests are not validated the normal way.
And that's what I wanted to say was standards.
Yeah.
So what I've noticed is there is no standard.
Correct.
And so depending on the testing company, depending on the testing lab, they can increase how many times they run, they multiply the sample, right?
Right.
And so some of them can be 30, 40, 50. It's all different. Basically, they can run the test until they get a positive if they want to.
Correct.
Depending, and again, even our own CDC came out and said, and issued a warning saying essentially, you guys might all want to get together and come up with a standard number, but everybody punted it, and no one still touched it as far as I'm reading. But what I want to say is here's an interesting thing. This is that same article. In 3 sets of testing data compiled by officials in Massachusetts, New York, and Nevada, folks, up to 90% of people testing positive carried barely any virus, a review that by the Times found. Let me break this down for you because it's a lot worse than the Times admits. The rabbit hole goes much deeper. Okay, the issue appears to be the ballooning sensitivity of the PCR test. It's so sensitive that it picks up inconsequential, tiny amounts of virus that couldn't harm a flea, and it calls these amounts positive. Therefore, millions of people are labeled positive, infected, who carry so little virus that no harm would come to them or anyone they come into contact with. That would be bad enough, but the truth is the PCR test is not able to produce any reliable number that reflects how much virus a person is carrying. A lot, a little, it doesn't matter. The test has never been validated in a large-scale study for the ability to quantify the amount of virus a person is carrying. And this guy goes on, I propose that how that study should be done in the real world and not in the lab. And so again, can we unpack that?
Well, that gets to the concept of a qualitative versus a quantitative test. A woman can go get a pregnancy test that'll say, yes, pregnant, no, not pregnant. But that doesn't give you as much information as saying, what is the level of the hormones being tested so we know how far along that pregnancy is.
Sure,
So just
sure.
to kind of frame that. And so this is a qualitative test. It's a yes, no answer. And that gets to the whole issue of whether that person actually has virus, because that PCR test is not testing for a virus. It's testing for a tiny little protein fragment.
Yep.
And that is not specific to this particular virus. Other coronaviruses could have it. Other cellular debris just from the normal processes in our body could have that protein fragment. That's why it's never been validated.
And let me continue with this. This says that that should mean these particular patients are visibly sick. They will have obvious clinical symptoms. Why? Because actual illness requires millions and millions of virus replicating in the body. So now we unblind these particular patients with high amounts of virus according to the PCR. We unblind these particular patients with high amounts of the virus according to the PCR. Are they in fact sick, or are they running marathons and swimming 5 miles a day? Let's see for real. This validation of the PCR has never been done. Therefore, the claim that the PCR can determine how much virus is in a human is completely and utterly unproven, period. Okay, so again, therefore, all the PCR tests being done on people all over the world reflect nothing about illness, infection, contagion, or transmission. The scam is wall to wall. But there's more. The PCR isn't even testing for a particular virus. God, see? Having someone that knows what he's talking about is really awesome. It's not even testing for a particular virus in the first place. It's using a piece of RNA assumed to be part of the virus. This assumption is unproven. And finally, as he's written and demonstrated for months, there is no evidence that researchers used proper procedure to discover a new coronavirus that is causing the pandemic. Therefore, the PCR test, as worthless as it already is, aims to show that the presence of a germ that has never been shown to exist. But let's lock down the planet, destroy economies, and untold numbers of lives in the process over a PCR test. So guys, there you have it. That's me talking about these tests. We're going to continue talking about it, but I just want everybody to know, as you see these numbers go up, as you see Kevin Dick come out, a completely unqualified, incompetent Kevin Dick, and come out and say, the healthcare system can't handle it, it's going to be overwhelmed. But I'm getting the same numbers from the hospital he must be getting. It's not overwhelmed. They're not at capacity. And even if they are, it's the same capacity they were last year. So stop the nonsense. Stop scaring everybody. Stop making everybody think they're going to die, that we're spreading mass death. And again, if that was true, we've had some fairly large rallies, protests here in the state over the last month. I didn't see any, mass death from it. I didn't see hospital admissions spike like everybody said they were. And this has happened in numerous places. And we're not talking a few hundred people. We're talking tens of thousands. So if that's happened and we haven't had this mass death, what's the reason, Dr. Ross?
What is the reason?
What is the
That
reason?
you could guess at. I think my own conclusion is that this all got kicked off before a lot was known, and they overshot the protective measures, which you can understand with the projections that were being made. As we've learned more, we see that those projections aren't accurate, but they've gone all in on that initial push to control everything. And I just don't see that they have an exit strategy. They have a way to pull back from that all in position that they've taken. And it's not doing anyone any good, is the
Well, listen to
conclusion.
this. Here's something that's awesome. Okay, so in the UK, just like Nevada, Massachusetts, and New York, they were having a 90% false positivity rating. Here in the UK Parliament, scientists have concerns about the PCR test. In the first weeks of September, a number of important revelations regarding the PCR test have come to light. First, new research from the University of Oxford Center for Evidence-Based Medicine, kind of some smart people, and the University of the West of England found that PCR tests pose the potential for false positives when testing for COVID-19. Professor Carl Hennigan, one of the authors of the study, Viral Cultures for COVID-19 Infectivity Assessment, a Systematic Review, said there was a risk that an increase in testing in the UK will lead to an increase in the risk of sample contamination and thus an increase in COVID-19 tests. COVID-19 cases in the UK. That's exactly what we're seeing here. It's the same problem we're facing here. And so again, I want to say this, the team reviewed evidence from 25 studies where virus specimens had positive PCR tests. The researchers state that the genetic photocopying technique scientists use to magnify the sample of genetic material collected is so sensitive that it could be picking up fragments of dead virus from previous infections. The researchers reached a similar conclusion as Dr. Britt, namely that a binary yes or no approach to the interpretation of the RT-PCR unvalidated against viral culture will result in false positives, with segregation of large numbers of people who are no longer infectious and hence not a threat to public health. What does that mean? Can you give that in simple speak for folks?
Sure, it gets back to one of the inherent fallacies of how the public health authorities are approaching this problem right now, which is looking at case definition. That's an epidemiology concept. It doesn't apply to the clinical practice of medicine. Again, trying to cast a wide net to not miss anything. But a case, by the CDC's definition, by the World Health Organization definition, could be somebody who's having no symptoms at all. So it's not ill. I think by this point, we have enough information that the definition for finding those people who we're concerned about that might be ill and might be transmitting the disease needs to be adjusted to at least make sure that these people have symptoms. And when everybody is getting tested, regardless of their state of health, you will get false positives. You can take any kind of lab test and get false positives. You could take a pregnancy test. You can put a million men through that test and you will find positives. We know that those are false positives. The same thing holds with any kind of cancer test, with this viral test. So that means that we need to be intelligent about how we're looking to apply the test and what we do with that information. And that's just not being done right
Well,
now.
and look at this. I love when you said, you're hitting everything I've been trying to touch on, but you say the wide net. And so they go on here to talk about how, that he also stated tests could be detecting old virus, which would explain the rise in cases in the UK. He stated that setting a standard for the cycle threshold would eliminate the quarantining and contact tracing of people who are healthy and help the public better understand the true nature of COVID-19. Then they went on to say that the UK's leading health agency, the Public Health of England, released an update on the testing methods used to detect COVID-19 and appeared to agree with Professor Hennigan regarding the concerns on the cycle threshold. On September 9th, the Public Health of England released an update which concluded all laboratories should determine the threshold for a positive result at the limit of detection. And this is not the first time Hennigan's work has directly impacted the UK's COVID-19 policies. In July, the UK Health Secretary Matt Hancock called for an urgent review of the daily COVID-19 death numbers produced by Public Health England after it was revealed the stats included people who died from other causes, The Guardian reported. The oddity was revealed in a paper by Yoon K. Loke and Carl Hennigan of the Center for Evidence-Based Medicine at Oxford University called Why No One Can Ever Recover from COVID-19 in England, a statistical anomaly. Their analysis suggests PHE cross-checks the latest notifications of deaths against a database of positive test results so that anyone who has ever tested positive is recorded in the COVID-19 death statistics. A Department of Health and Social Care source said, you could have been tested positive in February, have no symptoms, then hit by a bus in July, and you'd be recorded as a COVID death. I think that's exactly what we're talking about here. There's, when we get back into a little bit about this herd immunity, folks have heard me talk about herd immunity for a long time now, and this has been going back. Here's a very smart professor, Sunitra Gupta, okay, also in the UK, and you'll see that they talk about herd immunity. What is happening with herd immunity as it's affecting these tests, doctor?
Well, I don't think that herd immunity is going to have much of an impact at all on the positive tests. Again, because we have set that cycle threshold so high, we're not testing the right people. So that really is inconsequential. You're not even making a meaningful comparison if you're looking to find the point where our populations are safe, which you can make that determination off of herd immunity. But you can't do it off of that test. So the test is really overemphasized, and it's not doing anybody any good at this point.
Well, I think that what's important too is, so we go back now, here's COVID-19 countermeasures should be age specific. They knew this back in April, everybody. Back in April, they were talking about we need to be testing. Again, right here, among COVID-19 exposed individuals, people in their 70s have roughly twice the mortality rate of those in their 60s. 10 times the mortality rate of those in their 50s, 40 of those in their 40s, 100 of those in their 30s, 300 times that of those 20s, and the mortality rate is more than 3,000 times higher for children, since COVID-19 operates in a highly age-specific manner. So again, when we talked about protecting the nursing homes, when we talked about protecting the seniors, when we talked about protecting those in the high-risk community and with current medical conditions and autoimmune disorders, and again, as they say here, in the herd immunity, the fight against COVID-19, they talk about all we should have been doing is protecting older folks. They say, Britain is playing musical chairs with different services and businesses, and they talk about what should we do here? Under the vaccine scenario, the right strategy is to protect the elderly and other high-risk groups until they are protected by herd immunity, while the younger generation keeps society afloat. Okay? This is what we're talking about here. Yeah. They don't need it, and they went to find out that there was no point in keeping the kids home. Kids are not these mass little transmitters of COVID, and they're the least likely to be hurt or sick from it. And how do I know that? Well, everybody, I pulled the research between Finland and Sweden, and I want to just give you guys the stat because it's amazing when you think about what they've done to our children and how Kevin Dick and the rest of the incompetent coronavirus task force have locked our kids away. Here's the data out of Finland. Finland did a full lockdown. Sweden did no lockdown. Out of the kids aged 1 through 19, they had 0 deaths in Finland. They had 1 ICU admittance from someone that was 1 to 19 years old, doesn't say how old, and they had a total of 320 deaths. Oh, excuse me. They had 288 admitted to ICU. Sweden, with roughly 10,300,000 people, also had 0 deaths and 14 admitted to ICU. They didn't shut their schools. They didn't put their kids in masks. They didn't shut down their economy. Now, they lost a total of 5,000 people versus Finland's 320, but there's also 5 million more people in Sweden. So again, guys, anyone that tells you differently, this is, they did total ages too of kids population, excuse me, this is just the total ages, 5,525,000, all right, and 10,327,000 in Sweden. 0 deaths. 0 deaths among the kids 1 through 19. Why are our schools closed? And then they go in here in this data to say that very simply, so yes, we could open schools, but teachers older than 60 should work from home if they're concerned. where they can help grading exams. Yes, they keep the pubs open, but those in those 70s should stay for a while. Yes, keep the bowling alleys open, but skip the senior leagues. Yes, let the kids skate with their parents, but record their recitals for their grandparents to watch at home. Yes, open all restaurants, but only offer takeout to older folks. Okay, the point is open society for the younger generations, and when they have generated herd immunity with only modest risk to themselves, older people can come out as well. So you see, guys, there actually is an approach to this that could have been done in a much more measured and tactical manner other than shutting down the state of Nevada and sticking our kids at home. And Dr. Ross, you look like you want to say something. Go ahead.
Well, that gets to the idea of public health. Again, I'm trained in public health. I've been
You have training in public health
and
a degree in it, and you worked in it.
Yes,
not like air pollution, air quality.
No. Oh, okay. I was.
Just want to make sure he's a real public health doctor.
Both in rather civilian setting and then in the military. And so, from my perspective, I think it's really critical to understand that health, according to the World Health Organization, their definition of health is a complete state of physical, mental, and social well-being. So it is not the absence of disease. They specifically note that health is not the absence of disease. And here for the last 8 months, we have been myopically focused on preventing disease at the cost of the health of our communities. Not only individuals, but our communities. And there's a story out of Las Vegas from October 23rd, where the health officer in Clark County is advocating now for opening up the schools because of the impacts of mental health on the students who are being locked down. So he sees that perspective of not just preventing disease, but also promoting that overall state of health. And the cost of the lockdown there is too high. It's causing more problems than it's addressing.
Absolutely, and that's what we're seeing over and over again. And it's the reason for me having this discussion today. Again, I'm going to be bringing you guys another Facebook Live and digging in a little deeper. But too many times I have someone, you have little smart mouths in the comments of, where's your medical degree from, Joey, or what are the here's what the doctor says. His degree's in public health. It's very obvious now that we have gone down the wrong road. Why are we one of a few states that are still closed, still with restrictions, still without our kids in school, still without school sports? We have some of the highest death. We have the highest unemployment, third in the nation. Okay, and it's not solving anything. Here once again, the governor's coming out. We're in the same place we were back in March. He's saying the same nonsense. What the hell has the last 7 months been for? I thought it was to slow the spread and the curve and whatever else that nonsense was. But I feel like I'm waking up in Groundhog Day every day again.
Right. Well, the whole concept of flattening the curve has been completely misapplied. That intent is to make sure that you don't overwhelm the medical system in its ability to take care of people as they get ill. It never was about stopping disease.
Sure.
It supports gently getting the community to the point where there is herd immunity. And there's a lot going on in the media right now about decrying that this concept of herd immunity is just wrong-headed. Well, there are a couple of ways to come at that. And there's a great group of professionals out of England.
I was just going to say the Great Barrington Declaration is over 12,000 now.
Yeah. People, health professionals from around the world who have signed on to this declaration, which very clearly states that the better way to achieve herd immunity is to allow people to mix, to allow the healthier to get exposed to this, to build immunity and have it burnt out in that healthy population, which reduces the risk to the higher risk population, to those that would have a worse outcome from getting ill with this. And so we can approach herd immunity that way, which is what I advocate for. I'm a signatory to the Barrington Declaration. The other approach that's being taken now is to try to wait out having a vaccine that is going to accomplish the same thing if it is effective. If it is effective, we're going to establish herd immunity through vaccination. But there really isn't very much outlook for that because
where's that
Dr. Fauci just came out recently. And
Dr. Fauci, everybody, get your listening ears on. I want you to write this down. This is gospel, according to some of you Fauci's talking, same guy that said we didn't have to wear a mask in April and May, and then came back out and said we had to wear them. He's got some other, what does he say about the
Yeah,
vaccine?
so the early COVID vaccines will prevent symptoms, but not the virus. He very clearly states that
That's
this
awesome.
is going to reduce symptoms in people, but will not make any difference in the transmission of the virus. So, you know, again, we can establish that herd immunity the natural way, the way that we know is effective, as outlined in the Barrington Declaration, or we can lock down, we can hold out for this artificial means with a vaccine, which the outlook, according to Tony Fauci, is not that this will be effective anytime soon. And in the meantime, we're taking on all of the damage that comes to our overall health from not having an effective economy, from not having social interactions, from not having any of the normal uh, family interactions. I mean, look at what's happening in California now, where Governor Newsom has made the mandate that no more than 3 families can gather for
I mean,
Thanksgiving. It has to be
it's
outside.
insanity, and I hope people don't listen to this. I hope everybody pushes back. Come on, guys. I want to see in these comments. Get loud. We need to talk about this. I mean, sometimes I feel like I'm the only one in here fighting in the trenches. I know there's other people that feel the same way, but unless we talk about it, unless we get, more aggressive in the way that we're responding to this, it's just gonna keep hanging on. And again, at the end of the day, I'm here because I'm tired of seeing business owners that are still suffering. I'm tired of seeing the kids at home, putting on weight, their mental health, their psychological health, their emotional well-being is being compromised for no reason. Again, as I've just shown you, the study between Finland and Sweden, the schools. I mean, how are there 35 states across the United States open, normal? Some of them are doing masks, mainly in blue counties, go figure, or cities that are governed by Democrats. I'm sorry to say it, but that's what it is. But in the states that are open for normal business, states like South Dakota experiencing record growth, 180% in tourism growth. They can't give enough jobs to people. They don't have enough work. They don't have enough housing. They never closed. All right, they stayed open. So are you telling me it's a different virus that's in South Dakota, or it's in Idaho, or up in Utah than is here in California and Nevada? Because how are those people able to play sports and then carry on with normal life? And what is Governor Sisolak doing what he's doing to us here for if it's not really protecting us? Like, what's the deal?
Mass confusion, because there's the wrong approach to mitigating the spread of this. The CDC very clearly states that from their best estimation, they don't know for sure, this virus is spread by close physical contact. So the whole effort to mask and to do all of these crazy measures of limiting how many people can be in a proximity, there's no evidence to say that there's no research to say that that's effective. And I think the evidence out there in our communities counters that shows that it comes down to being intelligent in how you avoid spreading this, which comes down to a very simple principle, something that I've said right from the start. You wash these before you touch
Wash your
this.
hands. Use your hand sanitizer before you touch your face or mouth.
And the fact is that what is being pushed right now on everybody to mask is actually putting them at higher risk, because all you have to do is go out and look
It's a doctor.
in a group of people
Hello.
and see how many times they fiddle with their masks.
Yeah.
So in infection
There you
control policies and practices, which are very hard to do even in a controlled hospital setting, if you're going to apply a mask to your face to protect from spreading an infection, it's a very straightforward procedure. You wash your hands, you put on the mask, you don't touch that mask again until you're ready to dispose of it, and then you wash your hands again.
So it's not like a cloth mask that's in your pocket. It's been the same one there. It's been wet. So little Junior's kicked it on the floor. He's playing with it. You carry it, you get it wet, you put it back in your pocket. It falls on the ground next to the table where you're eating. That's not helping us.
No, it's not. And there are some studies out there that hypothesize and support the idea that the increasing numbers of positive tests come from wearing the mask, wearing a contaminated mask, where you're rebreathing your exhaled gases. And the lungs are an organ of elimination, just like your bladder is, your colon is. we get rid of stuff our body doesn't want.
It's
through
kind
our
of like
breath.
wearing a diaper on your face.
Face diaper. That's
Face
what I've
diaper.
come to.
I've heard a lot of people say
Yeah.
that. And then I get attacked because there's the really people pseudo, doctors now that want to challenge everything, and want to call out everything I say. But there really is a study, and it's not hypothesized. And I've read it. I went and read it on the CDC website that those that wore masks most frequently contracted the coronavirus versus those that didn't was only 4%. And I'll tell you why. I've never worn a mask. I'm not going to wear a mask. I wear a mask if I have to go into a business in which I respect the owner and I don't want them to get in trouble. So I wear it as briefly as I can because masks don't work. And if masks would have worked, we wouldn't be now having our governor go on TV and start talking about an emergency that doesn't exist and why we all got to, lock down again or really get focused again and we're going to beat this together. We're in this together. It's a bunch of nonsense. Okay, at the end of the day, the virus, you can't stop a virus, right?
Correct.
You can't stop a virus. There's the herd immunity thing. But here's something I want to say that I thought was important because this is from our CDC's own fact sheet. And one of the things they do say, though, is they say that the CDC 2019 COVID real-time RT-PCR diagnostic panel has been designed to minimize the likelihood of false positive test results. However, in the event of a false positive result, risks to patients could include the following: a recommendation for isolation of the patient, monitoring of a household or other close contacts for symptoms, patient in isolation that might limit contact with family or friends, and may increase contact with other potentially COVID-19 patients, limits in the ability to work, the delayed diagnosis and treatment for the true infection causing the symptoms, an unnecessary prescription of treatment or therapy, or other unintended adverse effects. That's the problem with the PCR test. Furthermore, they go on to say that the confusion around COVID-19 has come as a result of a shift away from evidence-based medicine. In a recent opinion piece published at The Spectator, Hennigan and Tom Jefferson, a senior associate tutor and honorary research fellow at the Center for Evidence-Based Medicine, the University of Oxford, wrote that patients have become a prisoner of the system labeling him or her positive when we are not sure what that label even means. The two scientists offer this conclusion and warning. Governments are producing a series of contradictory and confusing policies which have a brief shelf life as the next crisis emerges. It's increasingly clear the evidence is often ignored. Keeping up to date is a full-time occupation, and the advances of the last 30 years have at best been put on hold. That's scary stuff, guys. When you think about the fact that we've had information coming in from across the globe, from the Manila Times right here, from the Manila Times, from the lockdown skeptics in the UK. Here's another professor in the UK. Why do I pull these UK and European studies? Because they dealt with this a bit ahead of us. They were a few months ahead of us. So it would make sense that we either follow what worked for them or avoid what didn't work for them. And now there's every headline out of the UK and out of Europe saying lockdowns did nothing. Lockdowns did not affect the transmission of the disease. It might have done something in terms of resources for public health, but then again, they never were overwhelmed. There wasn't this. No one has been denied a bed, to my knowledge, or been sent home from Renown because they couldn't get a bed or couldn't receive treatment. Have you heard anything like that?
I have not.
So, again, folks, I'm trying to keep this under 40 minutes. I wanted to make sure that we addressed the concerns that you're seeing our governor come out and scare you with. And every night they come out with the new positives in Washoe County or Clark County. We're in the red, we're in the orange, we're in the blue, It's nonsense. It's a pie in the sky number that means nothing. Okay, again, the PCR test, 90% could be false positives. And even then, what does the term positive even mean? If you don't have symptoms, if you're not experiencing it means nothing. Okay? At the end of the day, we don't know. We don't have a validating tool that we're using or that we've put in place yet that we can all follow. So again, I want everyone to, don't take my word for it, take doctor's word for it, but research this yourself. Look at my Facebook. Look at the articles they're putting on there. You can reach out to me anytime. I always tell everybody, media@joeygilbertlaw.com, media@joeygilbertlaw.com. Send me an email. I will get back to you. Research this stuff for yourselves. Get out there. As I've said, and I'm going to say this again, if you're not sick, you don't need to go test, okay? If you don't have symptoms, you don't need to. But then again, to those older generations, to the seniors, to those in nursing homes, those in those high-risk areas, a high-risk community, those with autoimmune diseases, if you feel sick, if you feel something coming on, I would suggest you get tested. But again, for those of the large percentage of us, 99% or more, this is not going to do a whole lot to you, okay? So again, one thing you can do, and I've been trying to advocate for this all summer, is work on your immune system. Work on eating healthy, taking that vitamin D, that vitamin C, that zinc, eating healthy, eating your greens, drinking lots of water, getting outside, getting fresh air and exercise without the mask on. For the love of God, I'm going to smack one of you people I see walking around Virginia Lake with a mask on. I'm going to see you guys driving right on your bike with a mask on. When I'm up on the Tahoe trails and you pass me with a mask on, what are you doing? Like, where did you even get that from? Is that smart?
It is not at all smart.
Okay,
And I appreciate that you put in a plug for staying healthy.
Yeah.
And that's the one thing, it's most curious out of everything, all of the messaging in the public health community, you really never hear anything about what people can do to keep from getting sick.
Yeah.
They're trying to keep people from getting exposed, but not from getting ill. And that's pretty well established. It's what you laid out. There is a lot more specifically that can be put into what you talked about in keeping your immune system up, but very simple measures, vitamin D and vitamin C, get out in the sun. Absolutely critical.
My seniors, my people, like, listen, guys, like, you've been locked away way too long. Flu season's upon us. That's what's going to hit. They're not reporting that. How did the flu drop off the charts? There's like no flu. It's all corona. Or maybe it is flu. It doesn't matter. What matters is taking care of yourselves, making sure, yes, if you have grandkids, if you have children, if you have kids that are out and about, it might be best not to visit the parents at the nursing home or for their protection. But for those people there, you've got to get out. You've got to address your own immune system. You got to address your own health, and there's a way to do it. And it's eating healthy, getting sunlight, getting fresh air, getting exercise, and not being so afraid of something that has a 94% success rate or whatever there is, not dying amongst even the most vulnerable.
And I put in one more plug for how to stay healthy. Get out and interact in your community. Isolation is one of the very well-known risk factors for morbidity and mortality.
I want you to talk about this one thing right here, though. This is something that's very important. I want you to address this before we go. What's happening down in Clark County, what's happening here, why those of you who are responsible for keeping these kids at home and the harm you're doing to them and the suicide rates that are skyrocketing because of it, you don't have just blood on your hands. You have families that are now in pain over something that should have never happened. What are they talking about down there in Clark County?
Right, about the necessity of opening the schools back up so that the students can get together and interact. It has nothing to do with learning your facts that you need to pass your exams. It's all about the isolation leading to a marked increase in mental health concerns for the young population. And it's not only mental health, it's substance abuse, it's alcohol use. I've heard a lot of stories from patients who have not been able to get access to their treatment. Yeah. They're in drug treatment and they've been shut out. And so what happens? Well, they end up going back to what they were doing in the past, those dysfunctional behaviors, because they've lost that contact with the medical professionals. So that's one piece of it. But even more important is just the interactions that we have in our normal society. So that's just a critical piece, and it's being shown here in the story from Las Vegas, but it's everywhere.
Well, guys, listen, we're about to sign off here, but let's leave with this. We're noticing this with not just our young generation, but with our older generation. They are hurting. They have been locked away. They have been isolated. It is not fair what you're doing to them. It's not fair what's been done to them. We need to get everybody back together. These kids need their friends. They need their schools. They need their teachers. They need their coaches, okay? Not allowing these kids to train on their fields, on their courts, on their tracks, on their mats, that is unconscionable. And it's time to stop the nonsense. And if you got older teachers, older coaches, stay home. If you're worried about your health, stay in your mask at home and let the kids get back out where they belong. So again, we're going to wrap this up here, but I want to say to everybody, we're here to help. We are in the trenches. If you or a family member are worried that you've caught the coronavirus or you do in fact test positive, reach out to me. I will connect you with Dr. Bruce Fong here in Reno. He will get you on one of the many different therapeutics that are working. And to date, Dr. Fong and I have not had, I'd like to say Dr. Fong and I, we work together as a team. He's the doctor, but under his care, he has not had one person hospitalized. It's been amazing. We've helped hundreds from across the country. We're getting them on the therapeutics that are available anywhere. Don't let this dominate your lives. Don't live in fear. Get back to work. Get back to school. Demand these schools open. Okay, demand our sports get put back on, and let's go, everybody. We're down, but we're not out. We're going to continue to fight for you guys. And again, let's get this coronavirus behind us by fighting together and working together. Have a great day, and we will be
Excellent.
back in touch with you soon.